Let's learn about acute laryngotracheal bronchitis, which is also called CROUP. It is an inflammation of larynx, trachea, and bronchus. The respiratory tract get inflamed, and it leads to the signs and symptoms. The signs, symptoms, the etiological factor can be remembered with the mnemonic of the same, that is CROUP. Here C stands for children, that is it most commonly seen between the age group of 6 months child to 3 years of age group with the male predominance, and the child will be presenting with a cough, and more specifically it will be a barking or a brassy type of cough. Because of this respiratory tract obstruction, there will be an hypoxia, so the child's skin may change to blue, which is also called cyanosis. And R stands for respiratory infection. Because of this respiratory infection, the symptoms of respiratory infection, which include fever and cold, will be there. R also stands for retractions. Because of the respiratory tract gets inflamed, there may be a suprasternal or intrasternal retractions will be seen. And O stands for obstruction of an airway. As the airway get obstructed, the child will be having a noisy breathing, which is also called stridor. The more specifically, it is an inspiratory stridor. Because of the glottic area get involved, it may also produce the hoarseness of voice. And U stands for nebulization, which is the treatment of this CROUP. Nebulization with the adrenaline and budesonide is the mainstay of treatment if a child is suffering from acute ALTB. Because these are given, it reduces the inflammation, reduces the swelling, thereby improves the airway. And P stands for para-influenza virus 1 and 2. It is the most common etiological factor, most common virus which leads to this acute ALTB. There are some other virus which cause this ALTB are respiratory syncytial virus and Haemophilus influenza virus. These are the other viruses, but para-influenza virus 1 and 2 is the most common cause. Let's see the pathology and the radiological finding and treatment. Here in this image, this is a normal airway, supraglottic, glottic, and the subglottic area. Because of the para-influenza virus infection, the airway, that is subglottic area, gets inflamed and it is swollen. So there is a narrow respiratory tract. Because of this, all the symptoms and signs is produced. This picture, when taken as an X-ray, soft tissue neck, AP lateral view, it shows a tower sign, tower of a church like sign, because of this narrowing of the trachea, and this sign is called the steeple sign. It is seen most commonly in acute ALTB. Because of the infection and inflammation, there may be also secretions and crusting will be there. So going on to the treatment part, because of the infection, the child will be having poor intake and they will be dehydrated. So hydration should be ensured. Either oral or IV fluid should be given. Steam inhalation to break the secretions and crusting to improve the airway. Antibiotics or need not should be given necessarily, but if we suspect a secondary bacterial infection, they should be started. And nebulization with the adrenaline is the main treatment for this acute ALTB. Because this adrenaline causes vasoconstriction, thereby reduces the vascular permeability and edema gets reduced. So from the swelling, it may return back to this healthy part, which improves the airway. Steroids like hydrocortisone, dexamethasone, budesonide may also be given. They are either given as the oral, IM, or nebulization. If there is a severe respiratory tract narrowing and the patient is in severe respiratory distress, so we may plan for intubation, or in rare cases, tracheostomy may also needed. The intubation and tracheostomy is planned when the child respiratory rate is very higher and the child is in the hypoxic state, which leads to the hypercapnia, that is accumulation of carbon dioxide within the child's body. These all leads to the decreased neurological function. When the child is GCS is low, then we may plan for an intubation or tracheostomy.